Okay.
Yes, it's on
All
now.
right. Yeah. So, like I said, the topic I was asked to speak on is drugs and supplement metabolism and its impact on the health. Actually, I'm standing in for pharmacist Oshilaja, who had to go on an official assignment, but I will try my best as much as I can to do justice to the topic. Well, to start with, what is drug metabolism? Drug metabolism basically is the biotransformation of drug, the process by which drug is biotransformed, like changed from one form to another to make it less toxic, to make it available to the body tissues to use, and to get easily excreted from the body. That is basically what drug metabolism is. And when we talk about metabolism, it involves a lot of stages. First of all, when you take drug, for whatever reason it is you're taking it for, we have to understand that the dose we take is very, very important. So there are two processes that can happen, two things that can come as an aftermath of taking drug. It could be that the drug will be beneficial to the body, and at the same time, it could be that it could have some adverse effects, which we call toxic effects to the body. Because when you're taking drug, it's either that the drug is detoxified in the body, or it is metabolized into a more active, or should I say reactive metabolites. Reactive metabolites in the sense that it could end up being more harmful to the body. And this could affect our health in the long run, that is overall health. The major organ in the body that helps in the metabolism of drug is the liver. Basically, there are some other organs that could assist, but then the major organ for metabolism of drug in the body is the liver. So the reason why I would emphasize the dose of whatever drug we take is that if the liver becomes overwhelmed in whatever way, it's going to affect a lot of things. The liver might become injured. There might be tissue in, there might be injury to the liver. The injury would not lead to damage of the liver, which would affect every other organ in the body. Because usually our body system, all the organs in the body, they don't work in isolation. They work in synergy, like they work as a team. So when one particular part of the body is dysfunctioned or has some form of damage, it could lead to injury in some other, or dysfunction rather, I think that's the word, dysfunction in some other organs of the body. And basically we don't think of the impact of some of our activities as humans in terms of our habits, the way we consume drug, as if we are taking, we are taking snacks and all that. And when you talk about drug abuse, that's another thing I will talk on. People, what comes to mind is that, oh, probably some set of people that take cocaine, some set of people that do this, that, go as far as taking marijuana and all that. But really, I can say that in an individual's lifetime, there are certain occasions in which everyone would have abused a drug in one form or the other. And we try to like emphasize this when we talk to people in outreaches, in public health talks and all that, that when they talk about drug abuse, just don't think it's when you take cocaine and all that. When you keep on taking paracetamol, drugs like paracetamol, aspirin, alabukun on a daily basis for no just reason other than I'll have to sleep well. It helps me sleep well. You are abusing the drug. So we have to be very careful, because all these things we take into the body, everything we take into the body, including water, has its effect on the body. And like the popular saying goes, too much of everything is bad. Yes, so there's no gainsaying the fact that everything has to be in moderation, no matter what. And when we talk about supplements, supplements usually entails substances that helps us retain, or rather replace, some deficiencies in the body, things that we cannot easily, substances that we cannot easily get from food, or we don't get adequate amounts of from food. For example, we talk about vitamins. Vitamins are the major things. Vitamins like vitamin A, vitamin C, vitamin D, and and others like elements like calcium, magnesium, and all that. Typically, we should be able to get these things from food. Yeah, when we plan our diet very well, and we focus on getting a balanced diet, we should be able to get these vitamins and minerals from our food. But there are instances whereby you can't get adequate amounts, probably in instances of illness, malnutrition, and all. So you might be advised by your doctor or healthcare provider to go on supplements. So, and this supplement as well has its side effects. Even though the advantages are numerous, it has side effects if not taken in accordance to what your doctor says. You have to be cognizant of the fact that if you don't stick to the regimen, the treatment regimen recommended to you by your healthcare professional, then there might be their consequences to be faced afterwards. And we would also mention here, or I would like to mention here, that the metabolism of these things that we put into our body, be it drug, be it supplements, and all that, can overwhelm the liver, which is the major organ for metabolism of these drugs and supplements. When there's too much of it, it can exceed the ability, the quantity, the ability of the liver to detoxify them might be exceeded, and as such lead to injury, subsequently damage of the liver. And when we talk about the health impacts of some of these things, it's no joke when we say that it might lead to life-threatening events. Life-threatening events in terms of irreversible damage. Irreversible means when you cannot remedy the aftermath effects of what this drug, supplement, and what have you have caused. And at the end of the day, there's numerous deaths that occur that otherwise shouldn't have if more caution had been taken on the side of the patient or the individual involved. And really, some people, they believe it's not necessary for them to seek medical advice or seek the consultation of healthcare professionals, in that they believe if they take herbal remedies like herbal concussions, it could remedy the effects of what is actually wrong with them. Like it could serve as a palliative sort of for whatever ailment. Because some people, they don't even wait until they are experiencing any symptom, or they have a particular ailment before they go for all this herbal concussion and all that. They will say they are taking it in order to prevent the risks of having any of these ailments. But I would say again that everything we take into our body should be in moderation. And maybe I should mention at this junction that whatever it is that goes into the system is a potential poison. Please note that whatever it is we put into our mouth is a potential poison. What do we mean by that? For example, if we ingest too much, let's take for instance vegetables, different types of vegetables like ewedu, efo, and all that. Of course, we know that healthcare professionals tell us time and over again that it's beneficial to the health, it builds the immune system, it's rich in antioxidants that help us fight diseases and ward off free radicals and all that, and it prevents oxidation of our tissues and thereby preventing tissue injury. But if we take too much of it, what do you think happens, or what do you think will happen? Definitely, you would get to realize that you are coming down with different things. One of the things that is so particular, or that comes immediately after taking too much vegetable, is what? Running stomach. Most people experience that. As a matter of fact, some particularly because they are having or experiencing a form of constipation, some sorts of constipation, they will say, oh, eba mi lore for, go and make some vegetable for me, let me eat. So when we take too much of anything, it is trouble. And everything we put in our mouth is a potential poison, depending on the dosage. So depending on the dosage. So the dose is very important. And I would like to talk about examples of some of the things that we do, the habits of taking drugs, different types of drugs that we might not really think about as having adverse effects on our body. In the course of my talk, I've spoken briefly about taking alabukun, taking paracetamol on a daily basis. Fine, paracetamol, it's an anti-inflammatory drug, that's acetaminophen, and it helps prevent inflammatory reactions in the body. It alleviates fever, it helps relieve pain and all that. Yes, because it has analgesic properties and all that. But we should put at the back of our minds that taking like 2, 3, 4 tablets in a day, every night, 7 days a week, 4 weeks in a month, it's bad. It's not just bad, but it could be detrimental to our health. Most people don't consider this. What they will tell you is that, oh, if I don't take paracetamol and 7-Up before I go to bed, my God, I won't be able to sleep. I work so hard. What I do, I engage myself in hard labor during the day. And as a consequence, it's very, very hard for me to get a good night's rest if I don't take some form of analgesic. This habit is bad, and we should change our thinking, our disposition about taking drugs to sleep. There are things you can do to make you sleep, to help you relax your nerves without taking drugs. An example, or a good one, would be taking warm milk at night before you go to bed. Another that I'm going to talk about, or mention rather, is taking a warm bath before going to bed. Don't make the water too cold, don't make it too hot. Just warm bath once you're about to go to bed. Not that you take your bath and go doing some other activities or whatever. Just few minutes before going to bed. It helps you relax your nerves. And I would think some of these habits that we get into in terms of drug abuse, taking all these drugs on a daily basis, is just about mindset. Yes, that's another thing. The psychological effect that some of these drug provides for us is rather too soothing for us to discard it as um, not beneficial, or that it's going to have harmful effects for us in the long run. The psychological effect that I'm talking about is that we are having this belief we are refusing to let go, in terms of, if I don't do this, I won't be able to achieve this. That is, if I don't take this particular drug before going to bed, I won't be able to have a good night's rest. You should just give your body time. Get into the proper mindset, as in get into, discard this belief that there are some things that cannot happen if you don't take some certain things or some certain measures. But of course, if you try some other ways, there are so many things that can remedy the effect of insomnia, which is difficulty in sleeping and all that, or sleeplessness. So I would say that we should be mindful of all these habits, beliefs, and general thoughts that are not beneficial to us, or they're not going to be beneficial to us in the long run. Another that I know that people do abuse a lot, another is the group of antibiotics. And there are different types of antibiotics, and I can tell you there's no single type or class of antibiotics that have not been abused, or that are still not being abused by individuals. Where you get people, or when you see people having something as slight as, I wouldn't want to call it slight, but if you see people come down with just boil, yes, ewo, you will see them running to the pharmacy saying that, oh, Mufelora tetracycline, I want to go get tetracycline, I want to go get ampicillin. There are different types of antibiotics that they use just to combat AWO, that is boil. And the thing here is that if you keep taking antibiotics, your body, when it gets to a particular level, when it gets to a particular stage, we develop a form of tolerance to the drug you keep on putting into it. That is one. Secondly, there's what we call antibiotics resistance. Now that you've used ampicillin, tetracycline, or whatever form of antibiotics you are fond of buying at the pharmacy for a little condition, or whatever condition that you feel you should curb by the use of the antibiotics, when it comes to the stage, or when it comes to the time or period that you truly and sincerely need the antibiotics, when this antibiotic is administered to you, it won't work. Why? Because of antibiotics resistance. That it's just as simple as that. So the more we talk about this, the better, because it's going to make people be in the know, and it's going to help them make informed decisions about their actions, the aftermath of the actions, because most times we act ignorantly without giving a thought to the consequences or aftermath of our actions. And another is that people would just want to be consoled by the fact that, after all, I don't have enough money to go seeking the help of a healthcare professional. That is why I am forced to go to the pharmacy to go get drugs, or that's why I just make use of herbal concoctions and all that. Well, my dear brothers and sisters, I would say that is no excuse. Fine, we know that things might be difficult, you know, the economic situation of things in the country might be quite, you know, intimidating, and, you know, it's scary sometimes when we don't have enough money in our pockets to feed our families, not to talk of, you know, having the luxury of some other things. But then I will tell you this, our health is very important. As a matter of fact, that is the basics, the basic for which, or the basis rather, for which we can take good care of our family or look after our family. For instance, if you don't take care of your health and you are a father of 3 or 4 kids, you've got a wife, and you fall ill every day, like you don't take enough steps, or enough, you don't think it as being necessary to go seek the attention of an healthcare professional, and you keep on abusing drugs, doing self-medication and all that, and at the end of the day, you get your liver injured, you get your kidneys injured, and it turns to a complete damage of the organ. Think about it. How much would you use in taking care of yourself? Because now the problem that started as a pinpoint, you know, as something very minute, has exploded in your face. Now you'll be left to take care of yourself, source money to take care of the damages you've caused to your organs, and at the same time, your family will be there needing your care. So I would say that we can't overemphasize the fact that money should not be an excuse for us to engage in drug abuse. That is, engaging in self-medication is not an excuse for us not to take good care of ourselves and, you know, seek the attention or the help of medical healthcare professionals and all that. What I'm saying, please, I don't want to be misquoted. I'm not saying that when a child has a headache, or if you've got a headache, the next thing you do is run to the hospital. No. I'm sure I'm talking to intelligent minds, and the message I'm trying to pass across is well understood. For little ailments, of course, you can take over-the-counter drugs, you know, like the aspirin, paracetamol, and all that. But when you see that the symptoms you are having is getting recurrent, you know, it's becoming recurrent, and it's recurrent in terms of coming back, you know, you maybe every 2 days, every 3 days, you keep on having this headache, you keep on experiencing this chest pain, this particular pain in the side of your tummy and all that, please seek the help of professionals. It is very important. Don't engage in self-medication, self-diagnosis, and all that. And like I said, the use of supplements is highly encouraged because it has a lot of health benefits. But if care is not taken, it can also impact our health adversely. I've given examples of some drugs that people abuse, some supplements that people take. I'm going to give example, and I'm going to give an example of one in particular that people have used. Examples of supplements are vitamin A, vitamin D, you know, calcium, folic acid, and vitamin C. So one particular supplement that people abuse is vitamin C. And I know that a lot of people can relate with me on that. For vitamin C, it has a very low level of toxicity. That is, even if the chances of you getting overdosed on vitamin C, it's very low. Because for you to have, or for you to be considered as having taken an overdose of vitamin C, you ought to have taken more than 2,000 milligrams in a day. And of course, before you can get to that amount, probably the person is trying to, like, you know, attempt something that we don't know, maybe a suicidal mission or whatever. You can get to 2,000, but for it to be so detrimental to your health in terms of causing damage and all, I think scientists put that, doctors put that at 11,000 milligrams or thereabouts. But we shouldn't forget that I said everything you put in your mouth is a potential poison. So even though vitamin C has a low level of toxicity, it can still result in you experiencing some discomfort, some level of discomfort. And the adverse effects, like the side effects, could include abdominal cramps, stomach pain, vomiting. You can feel nauseated, and a general body discomfort, so to say. So we have to know that all these things has to be taken in moderation. Then I will speak to the females amongst us, the mothers, potential mothers, and all that. Particularly for those that are pregnant or that are hoping to get pregnant anytime soon. When we go for antenatals, you remember that at the antenatal clinic, the doctor will prescribe some vitamins for you, some supplements, one of which is folic acid. Folic acid has a lot of benefits for women in the childbearing age, and usually it's recommended that if you belong to this group, the childbearing age, like if you are there's possibility that you can conceive in the next 2, 3, 4, 5 years, you should be one of those that are particular about taking enough vitamins in order to assist with the gestation period and subsequently birth of your baby. And folic acid is a supplement that is usually recommended to be taken pre-pregnancy, like before your pregnancy or before you take in at the pre-pregnancy state, you should be taking at least 1 tablet. Then eventually when you get pregnant, it's recommended that you take a tablet every day. And the reason for this is that folic acid helps prevent or reduce the risk of birth defects in your children. So, and this is very important in terms of helping us maintain a good health status ourselves, and as well guaranteeing that of our baby. And you don't really have to be taking tablet supplements, in the pills, tablet form or whatever. Like I said at the beginning of my talk, beginning of this session, you can get all the supplements from your food. Just ensure you eat a balanced diet. Green leafy vegetables, for instance, are rich in folate. So when you consume this in the right proportion, in the right amount, at regular intervals, it gives you most of these things, most of these vitamins, most of these supplements naturally. You get them from food. You don't need to be taking pills and all that, not to talk of now going to the level of abusing it or for it to become detrimental to your health. And I would also like to speak about the importance of not or being careful, the importance of being careful when it comes to all this herbal concoction, what we popularly call agbo. most of these preparations, they've not undergone clinical trials. They've not been tested repeatedly to know its efficacy. We don't know the dose at which some of these preparations work optimally, and at what dose it becomes detrimental to our health. So because of this reason, we tell people to be very careful when it comes to drinking them. As a matter of fact, my family will attest to the fact that I am an advocate of herbal treatment, like in terms of herbal preparations and all that. Like when you go, when you use plant extracts and all that, it has been proven to have beneficial effects in so many instances. But at the same time, if I say I am a pro and advocate, I'm not an advocate, but I'm not against people taking herbal supplements or herbal preparations in minute quantities. That is me. Some healthcare professional, like I've gotten into conversations with some healthcare professionals who totally and completely disagree. For them, it's a no-no. You don't take agbo, you don't take any form of herbal preparation. Why? You don't know some other active ingredients. According to them, you don't know some other active ingredients that are in the preparation, or the particular plant contains that can be toxic to the body, or that might end up injuring the cells of the body. So because it has not undergone clinical trials, that has not been studied fully and all that, that's their argument. But for me, I believe that some of these things work. As a matter of fact, in Africa, I would say we are blessed in that we've got this this rich, very, very rich supply and abundance of herbs that are medicinal, plants that are medicinal to our body. But going the line, or going the way of the healthcare professionals that tell you that agbo and every other form of herbal preparation is a no-no, that you shouldn't go near it, you shouldn't drink it and all that. The reason for having this stance is just that people abuse it. So just like I have said, or we've discussed about drugs and pills, supplements in terms of vitamin C, vitamin D, vitamin A supplements and all that. The same principle applies to a consumption of herbal supplements and preparation. All of these things, when you take them into your system, they have to be metabolized. And the major organ that does this in our body is the liver. So when the liver becomes overwhelmed, when the quantity of these supplements, drugs, and herbal preparation overwhelms the ability of the liver to detoxify them, it becomes a problem for us. It can lead to different sorts of things, and the aftermath effects might not be something so pleasant. It's not something we want. It's not something we desire. So the reason why we have to be careful in terms of what our practices, our daily habits, or our disposition to taking of drug, herbal supplements, and just over-the-counter supplements, what our disposition is. We have to be careful about all that. Well, I don't know how much time I've got left, because I think I have spoken about some of the major things I've got on my list here. So, and I don't know if the moderator would avail me how much time I've got left so I can just summarize. If you can
So
put that in
inshallah,
the chat.
okay, you have about 5 more minutes to go so that you can have the Q&A.
Okay, thank you very much, sir. So in a nutshell, what we've been discussing about is drug metabolism and its health impacts. We have to understand the fact that we cannot continue to take drugs indiscriminately. Like we cannot continue to take drugs that have not been prescribed to us by an healthcare professional. That is one. We should be mindful also of how we take over-the-counter drugs and how we self-medicate ourselves, our children, and members of our family in general. We should be mindful. Why? Everything we take into our mouth it's a potential poisoning, like I said, and it has to be detoxified. Drugs, supplements, herbal concussion, you know, all sorts of preparation, it has to be detoxified in the body for it to be easily excreted out. All right. So, and if this does not happen, it becomes toxic to the system. It accumulates, causes injury. When it causes injury, it may eventually lead to complete damage of the organs and, you know, the organs of the body, and then shuts down the system as a final result, you know, as a final result in terms of if the damage cannot be remedied. So with this, I will say Alhamdulillah Rabbil Alameen for to Allah for giving us the opportunity to have this discussion. And I would also like to thank the organizers for giving me the opportunity to present this talk. Jazakumullah khairan.
Once again, Doctor, thank you very much for this session, inshallah. Alhamdulillah. I know it came in as an emergency, and of course, it shows you are also an expert in the field, and we really appreciate you for this session. I have, if you would like to ask your question, you can raise up your hand. I only have the ES here who has indicated he wants to ask a question. ES, inshallah, you can unmute yourself and ask your first question. Though I have some series of questions as well here that I want to ask. Okay, I think I sent it. There are lots of okay, yes, please, you can go ahead and ask.
Oh, I thought maybe we won't be allowed to talk. Okay, let me ask. So now, thanks to Doctor, despite the short notice, I think we informed her less than an hour ago to fill in for pharmacists who was actually made to come to the office for an on-call assignment. But having said that, she mentioned something. I want to ask like 3 questions that I have. Number one is that typically from where we are here in Nigeria, you do see all these roadside alagbo, and you see smoke, you see dust, you see everything, and you see one big pot of agbo, and they put inside the nylon and hot agbo inside the nylon, and that will be melting one way or the other, and you see people taking it with different colors. When you ask them, what is this thing meant for, they say agbo banyo and shishel, and they believe so much that it's working. So what? Yeah, they have several ones for fever, forms for pine, one for, I mean, a number of things. So what should be our disposition to that medically? The other one I want to ask is, it started with Swedish bitters. After all, we have yo-yo bitters, and the last time I can't even count the number of bitters that we have. So does the body really need all these bitters, or naturally the system has a way of taking care of those things that we need, our organs? So we've seen lots of bitters. Now we have a lot of alcoholic bitters. Karaole, I don't know, is it in fact they even have funny names.
There's Karaole, there's Karaole.
Yeah, you have very funny names. Yeah, and most of them, they more or less like endear people to it by saying that that's aphrodisiac quality, that it will make men to do this, it will make women to do this.
Yeah.
So that's bitters. That's the number 2 question. Number 3 question is, I have a driver in my former office. He said he used to use 2 paracetamol before. But over time, he's now using 4 paracetamol. I don't know if he's still alive now. I don't know how many paracetamol will be using. But he told me that he started from 2. Later on at night, he can't sleep until he uses 3 paracetamol. Before I left the place, he was using 4 paracetamol. So, and he said there's nothing he can do because without it, he can't even wake up the next day too. So what is causing this increase in dose? 2 paracetamol to 3 paracetamol, 4 paracetamol. Maybe if I can get him now, I will know how many paracetamol he's using now. So what do you think could be responsible for it? He was actually helpless. He tried it when I asked him not to, but it's the second day, he said it was as if he was in hell, that I just have to continue using it to be able to survive. That. So what can actually cause this? I know from what you said is not good. What can cause it? What can we do to, I mean, for those that are
and
affected?
yes, if I can just end that part of your question, your third question, by saying, for those that are already in that kind of situation and they just want to go off, is it possible to just stop it and it will not have an adverse effect on them, just like the driver's case?
Okay.
So, doctor, over to you, ma'am.
All right, thank you very much for the questions. I would like to start with the last question. An individual started out with taking 2 paracetamol tablets a day. Later, it increased to 3. Later, you said 4, and he claims that if he doesn't take this amount of paracetamol, he won't be able to sleep, and the story goes on. Well, I would like to inform you that if we don't change some of our mindset, no matter the amount of drug we take, we still won't believe, or we still won't feel the effect of the drug. That's one. But in his own case, there's something we call tolerance. I think the body, or his body, has developed tolerance to the drug. And that is what happens in majority of individuals. When you take a particular dose and you feel, oh, I think I'm not getting enough analgesic effect, I'm not getting enough relief, pain relief from this particular dose, and you increase it to 3, you increase it to 4, the body has developed tolerance to the drug. And why would the body develop tolerance to the drug? It's because of abuse. You keep on taking this drug every day. You keep on taking this drug every day. But of course, the body is no longer going to react the way it should to the drug, because you are assaulting the body, if you permit me to use the word. The drug is not going to, the physiological function and physiological effect that you should, that the body should give in response to the drug, it's not going to do that. And as such, you would end up not feeling the pharmacological effect of the drug. Assuming it gives it time, probably, okay, I feel some pain after work and I take 2 tablets of paracetamol just to alleviate the pain of that I'm feeling right now, and it gives it time, like maybe it doesn't take it not more than maybe once in a week or every 2 weeks. You won't have to start increasing the dosage like that, like taking 3, taking 4, taking 5 tablets. So in a nutshell, to answer that question, his body has developed tolerance to the drug. And if he's not careful, he will keep on increasing the dosage, like the dose rather, of the drug until it gets like maybe 10, 20 or whatever. and by that time it might be too late. By the time he realizes that he can't do anything about it, like in terms of the liver being damaged, he will find out that it was too late for him to, retrace his steps and all that. And that's in answering the question Ajigbo asked, that when you want to like reduce the dose, the number of drug you take, like maybe pills you take, that is it going to have an adverse effect? The answer to that is not straightforward. It's not a one way. It could be a yes, and at the same time it could be a no. A yes in the sense that in terms of not being able to remedy the damage the drug has caused, because the damage may have gone so deep, it may be so deeply rooted that no matter how intelligent, how brilliant a particular doctor is on health, they cannot remedy it. The least, or the most rather, they can do is probably tell you that they are going to do a liver transplant, or maybe in some cases when the kidney is damaged and there's renal involvement, they will tell you they want to do kidney transplant. But at the same time, we all know that all those interventions as well, it takes a lot of things for it to work, in terms of them suppressing your immune system, so your body is not going to reject the organ transplant, and at the same time for the organ to function maximally in your body and all that. So for the second question, the ES asks, I think it's about aphrodisiac, all these preparations that they tell you enhances potency, increases sexual performance and all that. There are some plants that contains aphrodisiac properties truly, and these plants would exhibit this effect, this beneficial effect, if you want to see it that way. But at the same time, I've said during the course of this discussion that the problem with most of these herbal preparations is that we don't know the dose, the right dose. We don't know people don't know at what point to stop. Is it going to be like taking a cup, 2 cups, 3 cups for it to have the effect that I desire in my body? Is it going to take me like getting a bowl or a whole bucket, if it's possible for an individual to drink a bucket of agbo, which is not? So we don't know the actual dose that is good and that is bad. So that is the disadvantage, or the major disadvantage that I would say goes with the use of all these herbal supplements. And I will tie that with the first question. Why I'm relating it with the first question is that the agbo sellers and all that, they just know that we can make this preparation, we can make this preparation. They put everything together as a concoction and give it to you to drink. There's something we call drug interaction. There's what we mean by drug interaction and drug chemical interaction is that when you are taking a particular drug, it might have a desirable property, like it may have a particular effect on your body that is advantageous. There's another drug that you're taking that has another property that is advantageous, like it's beneficial to your system. But the problem with drug interaction is that when you take some certain drugs together in combination at the same time, the effect of this drug A is going to counteract the effect of drug B. As a matter of fact, that is putting it mildly. That is, the effect of drug A might not allow this drug for you to feel the effect of drug B. But like I said, that is putting it mildly. Another thing that can happen is that there might be synergism or even potentiation, which is adding to the toxicity of the drug when both of them come together. Instead of now having beneficial effect in your body, they get to be toxic, and they become toxic to the system if taken together. And that's one of the evils, I would say, of patronizing all these agbo sellers by the roadside. Then I don't know if I'm taking too much time on this question already, but I would like to quickly chip in the experiments we are doing in my lab right now. Like the lab I work in here in the US, we take a look at the environmental impacts of having persistent organophosphates and the bioaccumulation of all these environmental contaminants in our system. And at the same time, another phase of the experiment is using medicinal plants to cure cancer cells. So what we do, just for me to describe it briefly, is that we take different types of herbal plants, medicinal plants as we call them, in different doses. What we did was that we used low dose, intermediate dose, and very high doses. So those were the 3 doses we used at different intervals. We looked at the effect of these doses of these medicinal plants, the effect at on cancer cell lines at 24 hours, and 72 hours interval. Now, this is what might interest you about the experiment. We got to find out that at low dose, majority of the plants exhibited beneficial properties. That is, they reduced or inhibited cell proliferation. They were able to kill majority or a large population of the cancer cells, or inhibit them from growing. But we now find out that at 250 microgram ml and at 500 microgram ml, that is when we increase the dose, we discovered that it did not inhibit, it didn't kill the cancer cells, it didn't inhibit them from growing, but as a matter of fact, it assisted them in proliferation. That is, it assisted them in, getting more. So, and this, we can see this because this is a laboratory study, and we were able to monitor, it's under monitored conditions and all that. But in your body, how can you monitor this? How can you monitor, or how can you tell when this agbo preparations that you are taking is getting too much for your system, or is becoming toxic to your system? You might not tell, and you cannot tell. So that's the major danger of this agbo, patronizing the agbo sellers and taking all sorts of things and bastardizing the system with it.
Doctor, you didn't mention the issue of the bitters, the Swedish bitters, yo-yo bitters, all the bitters that we have now, as asked by the ES. Does it really have any effect on us? Do we have to take them? Because now we have over, I don't even know, there are uncountable bitters here in Nigeria now.
Okay, for the bitters, of course, like I said, it's not as if the herbal preparations do not have beneficial effects in our bodies. It does. The Swedish bitters, for instance, as far back as I can remember, my dad used to buy it in large quantities then when we were little, and we were given, a certain quantity every week. When I say every week, I mean every week in very little quantity, and that is a teaspoon. He's not too learned, but I guess he knew that you should not overdo things by not giving it to us every day. These bitters that you asked about, some of them, I don't know about all of them, or especially these new ones that are springing up and all that. Some of them have beneficial effects in our body in terms of suppressing the proliferation of cancer cells or even inhibiting it in the first place. And some of them have anti-inflammatory effects, properties in terms of preventing oxidation and all sorts. And aside that, some of these Swedish bitters, or bitters rather, they contain anti-malaria properties, antibacterial properties, and even some have been proven to have antifungal properties. So if you take them, fine, but don't take them in an amount or quantities that would harm you. Like I said, I don't know about the new ones, especially the new ones that are springing up now. But for some of the old generation bitters that have been around since God knows when, you would have some kind of instruction. That is, you have a label in the pack that will tell you how to use it. Please, I beg of you, don't go beyond what the manufacturer has prescribed. Stick with the instruction. So that's one thing you should do, not just for Swedish bitters or any form of bitters and all that. For any drug you take, stick to the instruction. When you buy drug, even if it's over the counter and whatever, at least you will see on the pack of paracetamol and all that, they will tell you, do not take more than 2 tablets, you know, and if symptoms persist after 3 days, consult your doctor. That is an instruction for you. So even if you patronize bitters or forms of all sorts of bitters in the pharmacy or the ones that they sell at roadside and all that, please don't overdo things. And maybe I should go back to that statement. I would rather that you don't even patronize some of those ones that are packaged and sold at the roadside. Why? Some of them do not have NAFDAC approvals. They don't, you know, some set of people will just go in a particular corner of their house or probably a place or a location, conjure some things up, put it in the bottle, package it, and start selling to people on the streets without putting it to test, knowing what the toxic effects of those things they are putting in the pack. They don't know what the toxic effects would be and how damaging it might be to the health of others. So please, for those that are being sold at the roadside, I would advise you don't patronize them. But if you go to the pharmacy and you see that a particular bitters or drug, of course, drugs should have NAFDAC approval and all that. If it has NAFDAC approval, you can buy, but don't go beyond what the manufacturer of the product has prescribed. Thank you.
Okay, I have another question here. Assalamu alaikum, ma. Does taking oral contraceptive pills for a long period of time also have an adverse effect on the body system? Does taking oral contraceptive pills for a long period of time also have an adverse effect on the body system? And the second question from the person is, what method of family planning would you recommend? I learned the last time we have Dr. Rahima, she mentioned something about that. And unfortunately, she never had the time to expatiate on it, particularly the family planning for Muslims, more importantly for Muslim women or for women generally. What would you recommend that our sisters, our ummus, should go for? That will not be detrimental to our body system and our health. Thank you.
All right, thank you very much for the question. For the first one, I would say that taking oral contraceptives is not something I will encourage. The reason for that is that let's start with contraceptives generally. Any form of contraceptive has its own side effects. But it now depends either you are taking ingestible injectable, or you've got a rod implanted in your upper arm, or you are using the IUCD, the one they insert and all that, or you are even using just the, the latex, or latex as some would pronounce it, that is the condom. So every form of contraceptive has its own side effects. Let's know that. So that said, taking oral contraceptive is like taking a drug, right? So it has to be metabolized in the system. And we would say that, or I would say that, when you take oral contraceptives and you've been on it for too long a time, it can mess up the your normal function, the normal functioning of your reproductive system, or the normal functions of your reproductive system. It does not like eliminate completely from your body when you take it, in terms of being detoxified and getting eliminated in totality from your body. For instance, we've had cases of women who have been on oral contraceptives for a very long time. Then after a prolonged period, they decided that they want to get pregnant. But after stopping the intake of the oral contraceptives, they find out that it was difficult for them to conceive. The reason for this is numerous, but I could say, or I can say that one of the reasons is that the drug is still acting in the system. It's not completely cleared from the system. They will usually recommend or tell you that if you are planning to get pregnant and you're on injectable or you're on oral contraceptive, you should stop taking it 6 months prior to the time you want to conceive. But even at that, we've had women or cases of women that had to like wait for up to like 12 months, more than a year, before they could conceive. As a matter of fact, some it's totally hindered their ability to conceive. And studies have found out that it's an aftermath rather, or the side effects of using some of these oral contraceptives. So in a nutshell, all contraceptives have their side effects, but some have more side effects than the other. The side effects of some forms of contraceptives are more grievous than the others. And one of it is oral contraceptive, which I don't advise. Then to the second part of the question, which is family planning and recommendations. Well, I'd say it largely depends on the individual. You have to sit with your husband and have a discussion. That conversation has to take place between both of you. What is our goal? Like, do we plan to have a baby in the next 2 years, in the next 3 years? There are a lot of factors that comes into play when it comes to deciding on a particular type of family planning method you want to embark on. Is it that you want to conceive in the nearest future, or you want to like you don't want to conceive in the next 6, 7, 8 years? Is it that you are obese? Yes, the body as well, like your makeup also matters a lot in terms of your health condition, your existing health conditions and all that. There are some forms of contraceptives that are not recommended for women that are fat or obese, as the case may be. They will tell you that the implant is not recommended for such groups of women and all that. Then I would say that it largely depends on what your goals are and what your health status is, and your let me say disposition to some of these family planning methods. And I think Ajijibo made mention of the Islamic perspective or something. I'm not an Islamic scholar, so I might not be able to say much on it, but I know that the
Yeah,
withdrawal
basically,
method.
what I wanted to do, what I wanted to do for us is to tell us from your own specialty as a doctor. I'm sure the
So,
alphas in the house will be listening. They need to listen to you whatever way they want to do it anyway.
okay. So alhamdulillah, he has given me a leeway out. So thank you, sir, for giving me that bailout. So, but for the Islamic perspective, I know the withdrawal method is the one that is recommended. But for the other forms of family planning, like maybe I should just mention a few here. We've got the oral contraceptive that I've been talking about, the injectable, the IUCD, which is the one that gets inserted through the woman's vagina. You know, it stays there and it can stay for like 5, even 10 years. And we've got the implanter, that is the rod. Those are the rods that get the implants, rather. A form is implanter. Generally, we call it implants that gets inserted on the upper arm below the skin. So some of these contraceptives or family planning methods are short term, while some are long term. So I think I'll still go back to what I said initially, that you have to like sit down with your husband. It has to be a discussion between both of you. You have to have that conversation on what are your goals. Then when you have your goals, when you have what you want in mind, that okay, this is what we want to do, this is what we want to achieve, this is when we want to get pregnant, this is when we want to start a family, then go see a medical health professional for them to explain to you the pros and cons of some of these contraceptives. The horrors, as I've told you, the disadvantage is, or one of the disadvantages is that you might not be able to conceive at the time you want to conceive, that it takes a long time for the effect to wane off from your body for some people. Then for the injectable, it is the same thing. It might take time before you'll be able to conceive. So you might not be able to conceive immediately. For the IUCD, that is, they say it's a little bit safer in the terms that it's just a coil. They call it copper T. So when it's inserted through the vagina of the woman, and the woman is ready and it has been there for, like I said, it can go for like 10 years, is a long term. I think from what I'm saying, the participants in this session should be able to pick out those that are long term and short term. For the IUCD, the copper T can be withdrawn. It can be taken out of the woman's body and the woman can conceive immediately. At least studies have shown that majority conceive immediately after the removal. Then for the implants as well, that's a similar way of mechanism, in terms of it's inserted into the upper arm. While it's still there, hormones are released into the body to prevent conception. But when it is removed from the upper arm and it's out of the body, the woman can conceive immediately. Like, you don't have to wait for extended period of time before you can conceive. So I think with that, I hope I've been able to like answer the question. But then they are all hormonal. So, and anything hormonal, of course, is going to mess up with your system. Like for the implants, some of the side effects of that is irregular menstruation. You might end up experiencing spotting, right? And some women don't like that. You know, when you go out and you find out when you need to use the restroom that your undies are stained with spots and all that, they don't like that. And there are so many other things that that are involved in this thing. So you still need to talk to a healthcare professional, not necessarily a doctor. You can go to any healthcare center and get educated on the pros and cons of the different methods.
Thank you very much, Ma. I have the last question here Although I think you've answered this, but regardless, I also want to just ask. I think it's coming from Dr. Umudegana, and she says, "Thanks for the excellent presentation. You spoke against self-medication. I was wondering if Agbo usage as it fits that description. Ascended after a diagnosis by a medical doctor. Should Agbo be recommended for use after a diagnosis by a medical doctor?"
Well, that's
So that's
a
the question.
very good question. In the sense that if you've taken it upon yourself to go to the hospital to seek medical consultation with a doctor, and I'm sure before the doctor can arrive at a diagnosis, probably a series of tests would have been conducted, or if not series of tests, there will be some pathognomonic signs and symptoms that the doctor might have seen for him to come to the conclusion that you are suffering from a particular ailment, or this is the condition that you've got. So if you can go to the extent of taking yourself to the hospital and seeking medical attention, then why not just stick to the recommendations by the doctor? Because there's no way a medical professional is going to reach a medical diagnosis, a definitive medical diagnosis this time around, and not prefer solutions to it. Even in cases of end-stage diseases, that is life-threatening diseases and all that, they would still tell you what your options are. That okay, probably the cancer has aggravated to the 4th stage. It's so aggressive, it's metastatic, it's spreading, and at this stage, we don't think chemo can help you. We don't think black can help you, but do this, do this, do that. They will still give you options. They will tell you what your options are. So when you have a diagnosis already, I don't think it is advisable for you now to go to the route or through the route of taking Agbo again. Because like I said, you don't know what dose, at what dose you should stop. You don't know what quantity will cause more harm or aggravate the existing condition. And that would be my response to that question.
Okay, on this note, one just came in now, and it says, does one need to consult a doctor when one is aware and almost sure that the current symptoms are malaria symptoms? That's an interesting question.
Very interesting.
Let me read it one more time. Does one need to consult a doctor when one is aware and almost sure that the current symptoms are malaria symptoms? Doctor, over to you.
Then, just like the host said, it's a very interesting question. But if you don't mind, can I ask a question as well? How are you sure that the current symptoms are
malaria? You are sure. How are you sure that you are sure?
So that is just it. This is semantics. Like, are you not sure? You are sure that it's malaria, right? So are you not sure that it could be typhoid? Because some people, they will say, oh, I've been treating malaria all this while. I don't even know, Joe. Maybe it's not working. Maybe it's typhoid. But yeah, typhoid pneumonia, again, treats typhoid. So are you not sure that it could be? So, okay, he said almost sure.
Almost sure.
Okay, this is still the use of words. We are using words interchangeably here. I would say this. My response may be a little bit uncomfortable for some, but it's just what it is. And this is my own perspective. Some other healthcare professionals can have their own perspective. So, and here it is. If you are experiencing symptoms that are a similitude to the symptoms of malaria, my own advice is you can go to the pharmacy. Please stay with me now. I need you to understand, and I don't want to be misquoted. You can go to the pharmacy and get some form of medication. Why do I say so? Maybe if it was some other part of the world, I wouldn't have said you should go to the pharmacy and get some form of anti-malaria or whatever. Maybe if it was some other part of the world that I'm having this session. But because it is Nigeria, and we know that this is a condition that is common with so many individuals in the population, it's widespread that people are exposed to environmental conditions that predisposes them to having malaria. I would say you can go to the pharmacy and get an anti-malaria. Like I said before I gave this response, I said it might be uncomfortable for some to hear me say this. As a matter of fact, some healthcare professional may want to have my head for saying this. That's so you're encouraging people to self-medicate. But the issue is this. If you don't give some allowances in certain conditions, you might end up having a lot more people that will be in very devastating situations than you would normally. What I'm trying to say is this: when you go to the pharmacy and you see that, and before you go to the pharmacy, at least you know what is prompting you to go to the pharmacy. You know the signs and symptoms that you're experiencing, a similitude of what is experienced when you have malaria, and you get the anti-malaria drug and you use it. And I'm very sure that in the pack, there's going to be a label. There's going to be a leaflet that is going to tell you how to take it. You stick to the dosage regimen. You stick to the instructions and everything. And after taking the medication, you see that there's no improvement. You are not getting any better, or probably the situation is getting worse. Then you know without being told, or you should know without being told, that it is time you get yourself to a medical facility. Be it an healthcare center or a healthcare center where you'll be referred later to a hospital if it's not something they can handle, or you go to a hospital itself. Because the reason why a lot of people come down with what they shouldn't, like very devastating situations that they shouldn't find themselves in the first place, is that after getting drugs and self-medicating, like doing self-treatment and all that, they will still persist. They will keep on hoping that that thing will disappear, that condition will disappear, the signs and symptoms will go away, or they want to believe that the medication they are taking is helping. Like the intensity of the headache was much, but recently I can see that it's reducing. Okay, maybe I should take another. Maybe I should take more. Maybe I should take more. That is what actually kills us. So, and there are some other situations, or several situations that I would not recommend that you should go to the pharmacy to get drugs. But for particularly this malaria topic that the person asked about, I would say if it's not that you've treated malaria in any recent time, as I said, please don't misquote me. If it's not that I want you to understand this very well. If it's not as if you've treated malaria in any recent time, it's still okay for you to go to the pharmacy to get an anti-malaria, because the place or the region you find yourself is a place that is predisposed, or has a higher incidence of malaria occurrence and all that. But after medicating yourself or taking drugs, and you find out that if the condition doesn't improve or it seems to worsen, please seek medical help. So, alam. Okay, on my screen.
Sorry, I was just reading to myself. I thought I was reading to everybody. Sorry, I think I was on mute. So I'm trying to read that of Dr. Rahima, who says, "Thank you, Ma, for the presentation in Nigeria. Not all pharmacies have certified professional to give you best advice. 75% of drugstores are handled by individuals who see profitability in drug sales. Would you rather advise that they confirm this with laboratory diagnosis of malaria parasites and typhoid tests to be sure of what they are actually dealing with? Thank you." And I think this is from Dr. Emma. What she's trying to say, of course, obviously, is rather than you say you are super sure, you are almost sure, why don't you just go to the lab and do a test? And with that result, you can now say, yes, I can go to the pharmacy and get a certain drug from the pharmacy. I hope that's what she's trying to say, Doctor.
Yeah, I guess as much, because an interpretation I will give to what she has written is that it's better to have confirmation of the condition you're dealing with other than speculating, which is good. I think I've said that too. But in a nutshell, I will still stick to what I've said about living in a region that has a high suspicious index or suspicion index for malaria, for you to still treat yourself. If you've not done that in very recent time, then if you say that the condition is not improving, then you can seek
Doctor,
help.
what is recent time?
That thing you're dealing with.
How many days, how many weeks, how many months is recent time?
Okay, yeah, like in the past 2 months. In the past 2 months, because really 2 months will be like 60 days, right? If I'm right.
Yes, yes, yes.
Because if you've not for the past 3 months, but 60 days, yeah, you can. And if you see that the condition, like I said, is not improving, then seek medical advice, or seek professional advice for confirmation of the condition, because it might not actually be malaria that you're dealing with. It could be typhoid, it could be some other things that are just giving you the same symptoms as presented in malaria cases.
Exactly. Thank you very much, Doctor. It's been a wonderful session today.
I can see that Dr. Rahima posted some other thing here. She said, besides, in women, early pregnancy symptoms may present as malaria, and taking some anti-malaria can be harmful in the first trimester of pregnancy. I would agree with that, but just to chip in, I know we are running out of time here. Sorry, Mr. Moderator, but what I would chip in here is that
it's okay, so it's fine.
For malaria, for pregnancy rather, especially in the first trimester, there are some other signs and symptoms that you would see, symptoms that you will be experiencing that can give you a clue to giving it a thought that, oh, this might not be malaria, this might be pregnancy. Fine, not all women might know they are pregnant, but I would say that very little population would take in without knowing that they've taken in. Why? If you are pregnant, there are high chances that you might not menstruate. Why I said that might, because you might find it a little bit confusing, what I just said. There are some women that still see blood, even though they've taken in. Yes, it might not have happened to you, but it happens to some. It happened in my second pregnancy. So, but if your menstruation does not cease, there are some other things that you can see, or some other symptoms that you might be experiencing that might give you a high suspicious index to go for a pregnancy test. So, and I would like to leave it at that because of time constraints. Thank you.
Thank you very much, Doctor. I think we've had enough today, and I'm sure people will have one or two few questions. And you know, issue of medicals, in most cases, sometimes it's not all size fits all. People have different situations and they require different solutions. So inshallah, just like we did the other time, we'll be glad if you can drop your email address on the chats. It's strictly just email. And if anybody has one or two few other questions, or clarification or personal issues that you want to clear with our doctor, inshallah, you can always reach out to her on that email, inshallah. On this note, we'll round up the session, and we'll be coming up, inshallah, next week, Saturday, for another talim session. Please note, tomorrow, we're going to be having the Women's Wing special talim session on widowhood. Rois, Sharif, Afalalama Aleke, inshallah, Amir will be on tomorrow by 2 p.m. For those of us that will be available, we'll be talking about widowhood and the challenges they face and what is our responsibility as a community in fighting whatever challenges that they are facing, inshallah. So we shall be meeting tomorrow 2 p.m. and next week we'll continue with our health series. Once again, thank you very much, Dr. Amira. May Allah continue to bless you and every one of us. Subhanaka Allahumma hamdika ashhadu an la ilaha illa anta wa nastaghfiruka wa natubu ilayk. Subhana rabbika rabbil izzati amma yasifun. والسلام على المرسلين والحمد لله رب العالمين. صلوا على رسول الكريم صلى الله عليه وسلم. مع السلامة.